I'm Raquel Britzke and I'm a registered dietitian at Harley Street in London. Today I have a very special guest here. He wrote a book that I got very interested on. It's called the Pioppi diet. And I want you guys to learn a little bit more about this book. I have here today Dr Aseen Malhotra. He is a consultant at Harley Street. He's a cardiologist and he's been working in this field of saturated fats, low-carb diets, and now obviously he wrote this amazing book. So, Dr. Aseen, how are you today?
I'm very good. It's a pleasure to be here.
Thank you so much for accepting my invitation. I'm so pleased to have you here. I would like to know why you decided to write this book and what does it mean, the Pioppi diet?
Raquel, I think first and foremost, my job as a doctor, my duty as a doctor is to do the best thing for my patients and provide them with the right information and improve their health. And one thing that I learned over many years of my own research is that many of the perceptions out there that exist around diet, exercise, medicine are misinformed, they're incorrect, and are actually contributing to a lot of ill health in the population: obesity, type 2 diabetes, heart disease. So through my own research over several years, I wanted to address some of these big topics and try and give people information in a very honest, open, transparent way to improve their health. Now, in that journey, one of the root causes of this whole problem with obesity has been an obsession with lowering cholesterol for reduction in saturated fat. And that all came from American scientist, very famous, called Ancel Keys, who did some studies in the 50s and 60s. One most famous one was called 7 Countries study. And he correlated saturated fat intake and cholesterol with heart disease. Now, science has moved on since then, and we now realize actually that correlation doesn't stand up to real scientific scrutiny. And what was interesting was he was probably the most influential man in changing dietary guidelines in the USA in 1977 and the UK in 1983. Now, it's after that we've had this increase in obesity and type 2 diabetes. And I wanted to go to the roots of that. Now, Ancel Keys himself, he spent a lot of the time doing research in this tiny Italian village in southern Italy called Pioppi. And he spent a lot of time there, maybe 6 months of the year for 30 years, even living in this village where he got to know a lot of the people, the locals, and they knew him very well. And what's interesting about this village, Raquel, is it's one of the healthiest villages in the world still. The average life expectancy for men and women is close to 90, which is almost 10 years more than the average Tour de France cyclist, with no gyms, but we'll come on to that. And many people live over the age of 100, but they all live well, they're healthy into old age. So we wanted to go there, myself and my co-author, who's a former international athlete, we went to this village to try and discover what were the secrets. How does the way these people live, how does that fit in with modern scientific evidence around nutrition and medicine, so that we could produce a plan with science to help people understand how they can improve their health.
Okay, that's very interesting. And I heard about other places in Italy as well where people live longer. The blue zones, I think they have one in Sardinia, is that right?
Yes, Sardinia. There are other places around the world as well. There are certain commonalities which are relevant to all of these places. But I think one of the most important ones is there's no processed food. And these days, as we know, Raquel, processed food is associated with sugar. Most processed foods have added sugar in them. So the sugar consumption, certainly in Pioppi, during the time of Ancel Keys, was very low. They would have sugar, because it was expensive in those days, maybe once a month. I mean, that, and dessert, okay, maximum maybe once a week on a Sunday, but this is really interesting. These days, as you know, sugar has become so prevalent in our diet that we're having sugar for breakfast with sugared cereal. You may have some sort of sauce with your lunch, and then dinner you might have a bit of cake after dinner. So we're eating a lot of sugar, much more than is good for our health, and it's causing a lot of problems.
Yeah, of course, and also this fashion of a low-fat diet, I think was a huge problem, because then we come up with the trans fats and the vegetable oils. And instead of using the natural fats that we should be using.
Absolutely, and Raquel, as a dietitian, you realize the importance of fat in the diet for people,
Yes.
whether it's getting, fat-soluble vitamins or
Exactly.
important even for brain function, cognitive function, for our cells, for hormone production. And I think what's interesting is there's been an obsession, and you've mentioned this already, there has been this obsession with lowering cholesterol. Mm-hmm. That has been the main focus when it comes to diet. But actually, that's been misguided. We've had several years, 3 or 4 decade obsession, a campaign, if you like, globally, to lower cholesterol to beat heart disease, but it's failed to do that because cholesterol is not the major issue. It is implicated in heart disease, but much less than we think it is. And it's distracted or detracted us from concentrating on the main culprit, which is the major risk factor for heart disease, and also drives many other diseases, whether it's type 2 diabetes, a significant proportion of high blood pressure, and it's even linked independently to many cancers, and that is insulin resistance. And insulin resistance, which is essentially your body over time becoming resistant to the effects of insulin, so it becomes dysregulated, actually results in insulin resistance. And that is because of poor diet, which is essentially diet that's high in refined carbohydrates and added sugar, and also other lifestyle factors. So sedentary lifestyle, stress, lack of sleep, all of these things contribute. So if we address all of these things together, in actually in a simple way, which is what we try to do in the book, then very quickly, Raquel, we will improve individual health of anyone who follows this plan, this lifestyle plan, but also population health as well.
One thing that worries me a lot is that medical professionals, they don't know almost anything about nutrition. And we see patients coming from cardiologists, and I know it's not your case, but they don't have the knowledge. So their doctor told them not to eat eggs because it's gonna raise their cholesterol levels, for example. But that's something that we know, and we've been talking for the last, 5-10 years. We know that eggs don't really raise the serous cholesterol.
Yes.
Is that right?
Raquel, you're absolutely right. Cholesterol in food is now being debunked. Can you imagine? We had this public health message for years, and the food industry advertising was that cholesterol in food was damaging because it raised blood cholesterol. That doesn't happen, it's simply not true. And now even the American guidelines have said that cholesterol is no longer a nutrient of concern. So that's absolutely right. But you raise a very interesting point, Raquel, because you say that doctors, it's true, I don't remember getting a single lecture in medical school about nutrition. But guess what? Poor diet is now more responsible for more disease and death than physical inactivity, smoking and alcohol combined. So it's such a big issue that actually it's really important that medical professionals get trained even in basic understanding of nutrition. And on the other side of it, as you know, most dietitians and nutritionists, most of them know very little about medicine. Most doctors know very, very little about nutrition. There has to be some collaboration there. Yes. And with that collaboration, we can actually make more progress. And I think that's really important. And science evolves. One of the most famous men who was the brainchild behind evidence-based medicine, he said 50% of what you learn in medical school will either turn out to be dead wrong or outdated within 5 years of leaving. The trouble is you don't know which half, so you have to learn on your own essentially. Yeah. And a lot of us don't do that. And that's something that a journey I've gone through the last several years and had to challenge some of the things I learned. But we have to have some humility. Medicine is not an exact science. Even nutrition, we always have new information coming out.
It is hard because sometimes, maybe 10 years ago I was telling people to buy low-fat, food, and maybe 5 years ago I was doing that. And obviously now we change. So we learn that that's wrong. So we need to improve, and we need to be able to be humble, to tell people, no, please, I was wrong, but it's not my fault necessarily, but it was science. We didn't really know at that point. Yes. So we're trying to give, the best to our patients.
Absolutely. You're absolutely right. We need to be more humble. We may have got things wrong before. We put our hands up and say, listen, we've got new information now. And we have to change this, and we have to be willing to embrace it and move on.
It is amazing to see what the right diet, the right meal plan can do for a person's health. And I see that as well in my practice. For example, we have patients that they were diagnosed with type 2 diabetes. And for example, this patient I'm talking about, she went back to her GP, and she's done a test, the blood test, and then came up that she had nothing. And then the GP asked, what did you do? which kind of diet have you been doing? Because I don't see anything. You don't have diabetes. And she said, no, I've been suffering with diabetes for the last 11 years. And he said, no, but it's impossible. We don't have anything. So he just removed obviously all the prescription drugs she was taking. And she was so amazed about that. I think what works the best from my perspective, I believe that's more, you can have a moderate to low carb diet, so not really, you don't need to go really, really low carb. So you can have some carbs on your diet in moderation. And also you need to have fats. So the good fats and the good fats, no, because that's actually wrong to say, because if you think we can't say that saturated fats are bad fats, because they're not.
They're not.
So we don't really, I think that's a wrong assumption as well. So we need to have fats. And what I see people coming to the clinic and we do the vitamin profile test. And then we see that actually they are lacking in vitamins because they've been following a low-fat diet, so they don't really absorb the vitamins.
Well, in fact, Raquel, I mean, I want to ask you as a dietitian, you know, the approach you recommend, which is very much what is in the Pioppi diet, is that we say cut out the refined carbohydrates, so the carbs that lack fiber, so the white bread, white pasta, white rice. Those are not essential, are they?
No.
You don't need that. So there's a lot of messaging. We need to correct this, because there are people going out and saying these are essential food groups. They are not. And in fact, they probably have the least amount of nutrition, Raquel, as well. Is that not true?
Yeah, it's true. It's just like milk as well. If people think, oh, but I need to have milk. Why do you need to have cow's milk? Like, you don't really necessarily need to. If you want to have, you can, but it doesn't mean that it's something that's necessary on your diet.
Yes.
So it's the same for refined carbs, like you said, bread and pasta. You don't need.
And this is a nutritious, first and foremost, as you know, this is a nutritious diet. There are all these other benefits we talk about with health, but actually it's good nutrition. You know, when you're adding whole foods, whole vegetables, fruits, and as you say, the essential fats, then when you have all of that, then you're actually, you know, better for your nutrition and then better for all the other things as well.
Yeah, exactly. So I have a question for you as a cardiologist. Do saturated fats clog your arteries?
Dietary saturated fats, Raquel, do not clog your arteries. That is a complete myth. And in fact, very recently, myself and two very eminent cardiologists, both who are editors of major medical journals. One is Professor Rita Redberg in California, editor of JAMA Internal Medicine, and Pascal Meyer, editor of BMJ Open Heart. We wrote an editorial which said saturated fat does not clog the arteries, because coronary artery disease is actually a chronic inflammatory condition linked to inflammation, and insulin resistance is the risk factor. So when you've got inflammation and insulin resistance with all these other lifestyle factors, they all combine, and that's what increases your risk of heart disease. Dietary saturated fat does not clog the arteries. That myth needs to be busted. The public health messaging needs to be very strong on that. And actually, sugar and refined carbs have a much greater impact on your risk of heart disease.
But what happens, for example, why the NHS, you know, we should invest much more in prevention and nutrition actually, and in changing people's diets. We should be doing that, and I don't think we are.
Raquel, I think that's a very important point. I started my journey as a cardiologist operating on people's hearts, doing keyhole heart surgery, and working in an environment where my patients, after I treated them for a heart attack in the middle of the night, giving them a life-saving procedure, are being served junk food by the hospital, which is just sending out the wrong message. And hospital employees, there's a big problem of obesity there, because 50% of half of the 1.4 million employees in the National Health Service are themselves overweight or obese. And that's same for non-clinical staff as well as clinical staff. So that tells you that education, one, is probably wrong. Well, it certainly is wrong, that's an element of it, but also it's ineffective if the food environment is working against you. And if you're promoting and selling junk food in the hospital grounds, then what do you expect? And part of that problem is the medical profession and medical culture not realizing how important, how quickly changes in diet and lifestyle can affect health, but also they're misinformed about the drugs. They think the drugs are much more effective than they really are.
Exactly.
So you've got a double whammy. It's a problem, but we need to reverse that.
Yes, and we need to show to everyone, you know, what the diet can make for their lives, because I see that every day in my practice, and I love to do that. That's why I'm so passionate about helping people through the diet, through lifestyle changes, because I see that you know, your body is amazing. So if you put the right things into it, like, you're gonna really feel great and you're gonna change your health.
Yeah.
And I really believe in that. And we should use less prescription drugs as well. I think that's unnecessary. So every time you know, I get someone that's on statins and I look at their cholesterol levels and they're not really that high, and I just feel like, why they just don't change their diet? Like, you don't really need that. And I know, you know, that I know for a fact that if they follow this diet, maybe 2-3 months, they're going to be fine with it. And it's not really, as you said about the cholesterol, it's even not.
Oh, absolutely. Well, you know, I was involved in some original research published in BMJ Open last year with a number of international scientists. And what we did was we looked at people over 60. Was there a correlation between LDL, the so-called bad cholesterol, and heart disease and death? And what was that correlation? And we were quite amazed. The findings revealed there was no association with high LDL cholesterol and heart disease, and an inverse association with mortality. In other words, the higher your LDL if you're over 60, the less likely you are to die. Now, the explanation of that is because cholesterol is also involved in the immune system, and elderly people are more vulnerable to dying from infections such as pneumonia or stomach infections, and it may be that there's a protective mechanism there. But it's really quite extraordinary because it's giving you the opposite of what people believe. And you know, even with statins in the elderly, there is no good evidence that it reduces mortality, certainly for people without heart disease. The only people that really truly benefit from statins based upon published literature, which I have to say, you know, I have to mention this is almost all sponsored by the drug industry, but even so, the only people that really benefit in terms of lifespan from taking statins, there's some clear benefit, although it's slight still, is people who have had heart attacks or people with established heart disease, people very high risk. For everybody else, there's no what we call net benefit.
Okay. I also saw in your book that you recommend intermittent fasting. Can you just tell us a little bit about the benefits of that and why do you recommend a 24-hour fasting?
The benefits of intermittent fasting are really related to insulin resistance as well. So having a period, I mean, of at least 12 hours, I know that you recommend that for some of your clients, but 24 hours we do in a way that is much easier than what people think. So you never go to bed hungry. So we say, have your evening meal on a Thursday, and then basically don't have any breakfast or lunch the next day, and then eat again in the evening. And actually I do that, I practice that once a week, and I find that as a very, just for metabolic health generally, it's a good thing to do. But it has to be, as you say, you know, at least if you ideally can do it for at least 12 hours between meals. But 24 hours is something we just introduce into the plan that, you know, we want to get people to get used to the fact that they can fast and it's also good for them. And if you look at a lot of these traditional societies as well, Raquel, especially with religion, people would have one day a week where they would fast.
Or even many more days.
Absolutely. So, you know, they probably didn't know that at the time. Certainly in Pioppi they were doing that. It's sometimes because, you know, they were a poor society. Sometimes they didn't have food available all the time. So they would be fasting and they'd carry on working. But what they didn't realize at that time is that actually for health purposes, it's a very powerful intervention.
Also, another message that the government and all these institutions, they are putting out there is that people should actually be doing more exercises to lose weight. And that's one thing that I don't agree, because I don't think the exercise should be mentioned as something, as a measure to weight loss, because you don't really get a lot of results just from exercising. You need to change the diet. What do you think about this?
Raquel, it's absolutely right. Exercise has many benefits for health, but weight loss is not one of them. And I think that message is actually potentially harmful because it's been used, you know, it's been misused by food industry to deflect blame onto the obesity epidemic because of lack of exercise. It's all about what you eat, essentially. And you know, one of the people who I admire a lot is a very famous sports scientist in South Africa called Tim Noakes, and he says, if you have to exercise to keep your weight down, then your diet is wrong. And I tell some of my patients this as well, and it makes them think. So it's really all about diet when it comes to weight, but for health, exercise is extremely important. And even a little bit goes a long way, you know? Just doing a brisk walk for 2.5 hours a week, you know, so 30 minutes 5 times a week or at least 22 minutes a day, that in itself is actually, in terms of lifespan, is a very powerful tool. And in many of these blue zones, certainly Pioppi, there were no gyms, there was no prescribed exercise, they were just constantly on the move and they weren't sitting for prolonged periods of time. So some very powerful, important messages there. You don't need to be pounding on the treadmill or counting how many calories you're burning. because the body doesn't behave in that way. It's not as simple as, well, how many calories in the food is how your body absorbs and how it metabolizes. All of these things are so important.
Yeah.
And different calories have different effects on the body, as you know.
Yeah, and also I've seen some research showing that people who actually work out more, do more exercise, they feel hungrier. So you shouldn't really be looking into the exercise for something for weight loss. Obviously, we need to be active. That's very important to be healthy. But let's focus on the diet for, you know, for weight loss.
Yes, absolutely. Exercise actually can be a very powerful appetite stimulant. And then if you're eating the wrong foods, you're not really helping yourself very much. Especially when diet has a much bigger impact on your health. You know, certainly for risk of heart disease than exercise does.
Yeah.